If you're watching this video, you might be in an emergency department or at your doctor's office. Regardless of where you are, your healthcare provider wanted you to have a little bit more information on the medications and risk factors and preventative measures regarding your asthma. Asthma is pervasive throughout Baltimore City, especially among our children. It greatly affects thousands every year and is considered to be a major public health concern for this city. Morbidity and mortality rates of asthma in Baltimore City are disproportionately higher in comparison with the rest of the state. Where only 9% of children nationwide have been diagnosed with asthma, 20% of children in Baltimore City suffer from asthma. Baltimore has some of the highest hospitalization rates for asthma attacks across the nation, with Baltimore City's children having 2 times higher hospital rates than any other area of Maryland. Many of these hospitalizations can be prevented with proper management and education of asthma, which we will delve into later in this video. African American children and children living below the poverty line are shown to have poor health outcomes when it comes to asthma. African American children suffer more from asthma than their Caucasian or Hispanic counterparts in Baltimore City. They suffer from higher rates of emergency room visits, higher rates of hospitalizations, and overall higher mortality rates from asthma. In this video, we will cover basic asthma education that's critical to the health of your child.
Okay, Helen, it looks like on the symptoms that you're having the wheezing, shortness of breath, trouble getting oxygen, and the coughing. Looks like you're having an asthma attack based on your history. Mom, has this happened before?
Yeah, she has a history of asthma.
Do you know if she's used her albuterol yet today?
No, we ran out of the albuterol a couple weeks ago.
Okay, well, we're going to start by putting some oxygen on, okay? All right, take some deep breaths for me if you can. Sit up straight. Good. Okay, Helen, so this is your spacer. It attaches to your albuterol medication. So the spacer is going to help deliver this medication the best way as possible. It's also going to help with the taste, okay? So I want you to take off the oxygen mask, and we're going to take a puff on the inhaler.
How long do I inhale for?
10 seconds. We'll count with you, okay? So push down and inhale for 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good.
Good job.
So the longer you hold it in, that medication is going to work to open up your airways, okay? And this is your emergency albuterol. Okay. Hey, Helen, how are you feeling? You look a lot better.
Feel a lot better.
Yeah? Are you breathing a lot easier?
Yeah, definitely.
Good. Does that medication work?
Yeah, I feel like I can actually take a deep breath.
Good. Okay, well, let's talk about the medication that helped you with that. It was the albuterol. Do you remember using it?
Mm-hmm.
Okay, so this is your emergency medication.
Okay.
You want to carry this around with you at all times.
Okay.
So it's a fast-acting drug. It'll work in 5 to 15 minutes and really open up that airway.
Okay.
But you really only want to use it in emergency situations.
Okay, so I shouldn't just take it every day?
No, you don't want to take it every day, because if you do take it every day, more than what you actually need it for, it might actually make your asthma worse.
Okay.
Okay? Mom, do you understand also?
I think so. So this is just to be used in emergency situations.
Right. It's called a short-acting beta agonist.
Okay. And
Okay.
then I think though that we do have an inhaler she
Yeah,
uses
I
every day.
I do use an inhaler every day.
Is
Oh,
that
that's
bad?
good. No, that's good. That's probably your salmeterol.
Yes,
Right?
that sounds right.
Okay, that's a long-acting beta agonist. And that one you
Okay.
do want to use once a day, every day.
Okay.
Okay, so that's good. But the albuterol, just only in emergencies, when you're having that asthma attack.
So what's the difference between the emergency and just the long acting? Just that it acts longer throughout the day?
Right.
Okay.
That's going to be your maintenance drug, is that
Okay.
salmeterol. And this one's only for emergencies.
Okay.
Okay? And do you remember talking about the spacer before?
A little bit. I don't remember. Mom, do you know how
Yeah,
to set it up?
We don't have one of those.
You don't have
so
one
we
at
don't really
home?
know how to use it.
Okay. Well, this will be good because it'll give you as much medication as you need, and it'll make the taste better.
Oh, good.
Okay, so you want to take off the cap, put it in here, just
Okay.
like that. Slides in.
Okay.
You put your mouth on this side, opens up. You push down and inhale as deep as you can to get all that medication and hold it
Okay.
for 10 seconds like we did before.
Okay.
Okay? Before you guys head home today, can you tell me a little bit about what you learned in terms of how you can prevent this asthma attack from occurring again?
Well, I'm gonna try and make sure to like wash my hands as much as possible so I don't get any infections or anything like that.
Good.
And Mom, you gotta make sure the house, we don't have a lot of dust and
Yeah, we'll be doing
mold
some
and
extra
stuff like
chores
that.
around the house.
Yeah, yeah. And
I'll make sure that maybe we can get an exterminator in and just make sure we don't have a cockroach problem and clean up all of those areas with a lot of
Yeah.
dust and allergens floating around.
and
Good.
you know, try and just limit my exposure to like being outside when the pollution rate is high.
Good. You want to remember to take that medication every day too, right?
Yep.
Yeah.
Oh yeah.
We'll
I'm
come
gonna,
up with a good schedule so we remember.
yeah.
Maybe put an alarm on the cell phone. That could help you out.
Oh, that's a good idea.
Right. And also remember those signs and symptoms of when you're having an attack.
Okay. Yeah, I remember like I couldn't breathe. I felt like I
Just
couldn't
wheezing.
breathe. Just coughing.
Right. Good. So you use that albuterol, and if it's still not being managed, you want to come back in here to the hospital, okay?
Okay.
Okay.
All right.
All right.
Okay,
Thank
you
you.
so much.
Thank you, guys.
Bye. Alright, some of the risk factors for childhood asthma include presence of allergies, and these can be food or environmental allergies, a family history of allergies, and a family history of asthma, frequent respiratory infections, chronic runny noses, inflamed sinuses, severe lower respiratory infections like pneumonia, and heartburn. Other risk factors for childhood asthma would be a low birth weight and also exposure to cigarette smoke before and after birth. Other risk factors include eczema and other chronic skin conditions. African American males have an increased risk for childhood asthma, as well as those being raised in low income environments, and obese children have an increased risk for childhood asthma. Thank you so much for tuning in.